Next, we're going to have Ken Jacobs, the chair of the UC Berkeley Center for Labor Research and Education. He's going to talk about employer-based coverage.
Good afternoon, and thank you for having me here today. My name is Ken Jacobs. I'm the chair of the UC Berkeley Center for Labor Research and Education, or Labor Center. We're the outreach arm of the university, working with labor in California and providing time-sensitive, policy-relevant research on issues of importance to California's working families. So I'm going to talk about trends and what's happening with job-based coverage in the state. So at this point, half of all Californians still have coverage through an employer. That's nearly 19 million Californians. That 43% of Californians, it's their sole source of coverage, and another 7% have combined coverage, job-based coverage, and Medi-Cal or Medicare. As Edwin mentioned, many people with Medicare also have supplemental coverage through an employer. I should note that about 1.5 million of those with job-based coverage are insured through Taft-Hartley plans, or also known as multi-employer plans. These plans are jointly managed by a board of trustees made up of labor and management. Generally, they come out through a collective bargaining agreement, and they may cover workers in multiple states. In the rest of the presentation, I'm going to focus on working age adults. As you can see, there's almost close to 13 million working age adults in California who have coverage through an employer. It's overall 55% of working age adults are covered through an employer. That compares to about 60% nationally. California, for many, many years, has had a lower share of the workforce or the population covered through job-based coverage than the rest of the nation. The biggest sources of coverage for children, as I mentioned, are Medi-Cal or CHIP and job-based coverage. About half are enrolled in job-based coverage. And for seniors, of course, as mentioned by Edwin, the biggest source of coverage is Medicare, but we do also have a set of people on Medicare, here a little over 1 million, who also have coverage through an employer in terms of the Medigap policy. Next slide. So while more than half of Californian working age adults are covered through an employer, it varies greatly by demographic group. So as you can see here, lower income adults are much less likely to have coverage through an employer than those at middle or higher income. So only 17% of those in families with incomes below 100% of the federal poverty level are covered through employers, compared to 78% from those at 300% of the federal poverty level or more. And this is one of the reasons why Medi-Cal expansion is so important for low-income adults. It was mentioned because so many of them do not get coverage through their job, even though they may be employed. In terms of demographics, again, Latinos are much less likely to have employer-sponsored insurance than whites or Asians, so 41% of Latinos, 50% of African Americans, compared to 64% of whites and 69% of Asians. Working age adults are covered through a job. And non-citizens much less likely to have employer-sponsored coverage than citizens. Almost 60% for citizens, only 31% for non-citizens. So over the last 20 years, we've seen a significant increase in the cost of job-based coverage, or health insurance overall, and that's affected workers' wages, the number of Californians who are covered through a job, and benefit levels. So overall, as we can see, going back to 2002, family premiums increased nearly 6 times faster than inflation. Since 2002, they've gone up over 200%, 233%, compared to 40% overall inflation. So what that means is, at this point, a single plan, on average in California, offered through an employer, costs a little over $7,000 a year. That's equivalent to $3.44 per hour. A family plan on average now costs nearly $20,000 per year, equivalent to $9.43 per hour. So that is 17% of the median California wage for single coverage and 48% of the median California wage in order to purchase family coverage. It's important to note here that workers in low-wage firms are more likely to have higher worker premium contributions than those in higher-wage firms. So for single coverage, workers are paying on average in low-wage firms with mostly more low-wage workers pay about 25% of the cost of that single plan. In other words, workers with the least ability to pay generally face the highest premium costs. It's also important as we look at the amount of this is per hour to note that the rising healthcare costs have had an important effect on wage stagnation in the United States overall, as more and more dollars have gone into covering benefit cost rather than covering wage costs. Another effect of the decline or the increase in healthcare costs in the last 20 years has been the decline in job-based coverage. In California, that means we've gone down from about 61% of working-age Californians covered through an employer in 2002 to about 56% today. Nationally, that's about 67% to 60%. It has also had an effect on out-of-pocket costs. Now, interesting, Deborah talked earlier about the high penetration of HMOs in California, and you can really see that here where nationally only 17% of people enrolled in job-based coverage have no deductible. 83% have a deductible with an average of about $1,400 a year. In California, it's 54% without a deductible and 46% with a deductible, and again, a smaller than average deductible. That said, we have seen a rise in high deductible plans in California as nationally. Nationally, about 51% now have plans with deductibles over $1,000 or more of those enrolled in job-based coverage. In California, it's 25%. So growing, but still much lower than the national rate. In terms of when we compare job-based coverage to coverage overall, again, even if, as we've seen this increase in out-of-pocket cost, it's important to note that large group plans cover a much higher share of health costs than other private plans. So 75% of people enrolled in large group plans are in plans with an actuarial value of 90% or better. And again, that 90% is across the entire group. What's the expected average share of healthcare costs that are paid for by the insurance company versus the individual? When we look at small group plans, higher deductible plans are more common, so 37% have a silver or a bronze plan equivalent. When we get into Covered California with subsidies, that increases more, but again, we see quite a few, a little over half with 80% actuarial value or better, and that's really a reflection of the cost-sharing subsidies. When we get into the individual market that people are purchasing without any support, you can see those high deductible plans. You've got 71% in plans, at least a silver plan, but 40% that are in bronze plans or less. And when you look at that in terms of what that means, that's an annual deductible of $6,300 a year. So rising healthcare cost also affects the public. Workers and employer premium contributions are not subject to federal and state income or payroll taxes. That's estimated in California now. The value of that tax expenditure is $33 billion a year in federal taxes and $11 billion in state and local taxes. That makes job-based coverage the largest U.S. tax expenditure in the individual income tax code, larger than even the mortgage tax deduction. Turning to small businesses, small business employees do have less access to affordable employer-sponsored insurance than those in large firms. We can see that unpacked a little bit here. Overall, firms of 51 or more employees, 90% of those firms offer health insurance to at least some of their employees. In smaller businesses, it's 55%. Small business employees in small businesses are also slightly less likely to be eligible for that coverage, 85 to 89%. Less likely to take up, that's partly because of the higher out-of-pocket costs, 74 to 82%, which means overall in terms of the coverage rate, 66% of employees are covered through their employer who work for larger businesses compared to just a third for smaller businesses. Small businesses also are more likely to have large deductibles. We can see here about 42% have deductibles of $1,000 or more compared to 17% in large group plans. So now I want to talk a little bit about how large group plan or how employer-sponsored health plans are regulated in the United States. The key point is large group plans or employer plans in general are primarily regulated by federal law. Part of this comes through the Affordable Care Act, which sets minimum standards for employer-sponsored insurance. That includes, for all employer-sponsored plans, no lifetime or annual limits, maximum out-of-pocket limits, no cost sharing for preventive services, and the requirement that they cover adult children up to age 26. Small group plans are required to cover the 10 categories of essential health benefits. And we should note that most large group plans do anyway. And importantly, small businesses are charged the same amount regardless of their employees' health status or gender. The only variation is on age and geography. The Affordable Care Act also requires large employers to offer affordable coverage to full-time workers or to pay a penalty. Large employers with 50 or more full-time equivalent employees are covered by this requirement, and that applies to any employee working 30 hours per week or more. And the size of the penalty varies depending on whether they're offered coverage, whether they offer coverage to most of their employees or they don't. Now, the big law that you're going to get into quite a bit as you delve into what can the state of California do that affects what we do around job-based health coverage is the Employee Retirement Security Act of 1974, known as ERISA. And ERISA generally preempts state law governing job-based health coverage. Important to note, so what ERISA does, it was created to set minimum standards for employer pension and health plans as a protection to employees. And at the same time it did this, it set a common set of rules throughout the country. Now, California states cannot regulate employer offers of health insurance. We cannot tell employers what share of premium to pay, what services to cover, what employees or dependents to cover. That is all under federal law. What the state can do is regulate fully insured plans that are sold to employers in the state. So this is important. Some employers are self-insured. That means the employer bears the risk. And in that case, the state cannot regulate that insurance. Others are fully insured, means the insurance company bears the risk. And in that case, the state can regulate the insurance plans that are sold to the employers, not the employers themselves on this. Important to note that if you're an employee, you do not know if you have a fully insured or a self-insured plan. I mean, if you're in Kaiser, okay, that's fully insured. But outside of that, because employers are purchasing, are contracting for coverage through third-party administrators, so you can have a Blue Shield plan or a United Healthcare plan, and those could be either self-insured or fully insured. So just to give an example of how this played out recently, in Vermont, they attempted to require all plans to participate in their all-payer claims database, and the court ruled that they could not require self-insured employer plans to participate, or ERISA plans to participate. It would have to be voluntary. So it is worth noting, however, that in California, we have a lower rate of self-insured plans. It's about 32% or a third, compared to nationally where it's 61%. So overall, if we look, our large group fully insured is about 55% of the market, 9.5 million lives. The small group, 2.2 million lives, about 13% of the market. And the self-insured part is 5.6 million lives, or about 32% of the market. So in terms of review of the main takeaways here, half of Californians have coverage, continue to have coverage through an employer. Those coverage rates vary significantly by income, race, and ethnicity and citizenship status. The rising healthcare costs are affecting our rates of coverage, our benefit levels, and workers' wages. Small business employees are less likely to be offered coverage and have higher deductibles when they do have coverage through a job. And the regulations over job-based coverage is generally done at a federal level, and there are limited things that states can do. Thank you.
Very good. Thank you, Mr. Jacobs.